Okay, so we could start before your presentation. At first, we are very glad to connect with you, even though it was not in the form that we thought, but at least it was better than last time.
Now well, it worked. Apparently, the connection worked fine on Friday, but
yes.
Not on Monday.
Okay.
And so, I think the problem is between the hotel and Finland, although why it goes through Finland, I'm not sure. Well, I thank you very much for inviting me to present. It's a great honor. What I'd like to do, the main thing I'm interested in is potential collaboration between NIA and Sweden on the behavioral and social aspects of aging. And I might say I've just heard a little bit of what Peter was talking about. We already collaborate with Peter through the in-depth program. So I'll talk a little about NIA. Let's move to the next slide, which says NIA mission.
Yes.
And then I'll talk about some of the science and then get to the really important stuff on potential collaboration. So NIA is was established in 1974 to do research and training on aging. Next slide. We are one of 28, I think, institutes and centers at the National Institutes of Health, which is one of the largest biomedical and social behavioral research efforts that is global. NIH is about 30 billion and we're about $1.1 billion. Next slide. The director of NIH is Francis Collins, and among his emphases that he's brought to NIH include throughput technologies, translation, healthcare reform, and global health. Next slide. NIA, the National Institute on Aging, has both an intramural research program and 4 divisions, one on biology, one on neuroscience, one on geriatrics and clinical gerontology, and I run the division of behavioral social research. Next slide. That division covers a very wide field in terms of disciplines, demography, economics, psychology, a big focus on aging minds, cognitive science, disability, behavior genetics. We have centers and many longitudinal cohort studies and increasingly interventions such as ACTIVE, which is designed to improve cognition. The last article will be out soon on ACTIVE. REACH, which is an intervention to improve the health of caregivers for Alzheimer's patients. It's been widely adopted. And then the Experiment, which is a volunteer program designed to help the very low-income, low-educated, elderly teach in schools, and we don't have the results from that yet. Next slide.
Just ask you, are you like managing all these things, or do you also have like in-house research on these fields?
No, we manage these. Some of them are grants, some of them are cooperative agreements, a few are contracts. We also do a lot of work with the National Academy of Science and various statistical agencies through contracts. So we mainly work through the extramural research community. Let's move to the next slide.
Yes.
Principles.
Yes. It's on.
Important to note that much of aging starts really at birth. We take a life force perspective, and increasingly we are finding that early life disadvantage and early life has a long arm and reaches well into old age. And we are looking to see what can be done to turn that around. We do a lot of the integration of biology, medicine, and social behavioral science. Translation is very important. We've got 10 or 12 translation centers, and we do a lot of work on cross-national research we fund in other countries. Next slide. Um, I'm not sure which one. Do you see
It's
some of
on the population aging, the report. Why population aging?
okay. Um, uh, why population aging matters, a global perspective. Next slide. Um, it matters because it's totally reshaping the world. Speed of aging is faster or population aging is faster in third world countries. There's some countries like Germany, Japan, where you're getting population aging and population decline, and that's something we've never had before. Increased longevity has led to great economic growth, but the extra years have to be financed. There's the burden of chronic disease I'll get to at older ages, and there are capital flows in the macroeconomics. So if China sets up a national pension system, people will spend more, save less, and prices will rise, and that will affect large companies such as Walmart and all the exports. Next slide.
May I ask you, Richard, would you say that the interest for global health research is pure scientific, or is it a part of US science diplomacy approach that you want to understand the conditions in various countries?
I didn't quite hear that, but could you repeat that?
Well, it was more about if it's purely scientifically oriented, or if it's a part of from your government that science diplomacy approach that you need to.
Yes, I've heard of that.
Yeah.
No, we are pure science. We do not get into policy.
Okay.
We're not a policy tool.
No.
And at all.
Okay.
It must be pure. It must be. We do only pure science.
Okay. Next slide then.
Next slide. Well, this is just something that I've shown before, but I think it's quite remarkable. We're very close to a turning point in human history. When for the first time you'll have more people 65 and over in the world than people under age 5, and it's going to be true for the rest of human history. Next slide. And the big issue here is going to be the increase in support ratios. The blue is the current, and the red is for 2030, and it's based upon people 65 and over versus 15 to 64. But, you know, we all know that some of our children don't start work until late in their 20s. Some people retire well before 65, and some people work longer than 65 or volunteer. So I think we are beginning to look at this and to begin to look at the intergenerational transfers of money and time in terms of a concept of national accounts. We've asked the National Academy to run a study for us. A while back, I met with the British Minister for Science and Education, David Willits, and I think that the UK will co-fund that. Next slide. This comes from James Vorpel and Open. He's at Max Planck Institute, and we fund him. And this shows the female record-holding country in life expectancy, female life expectancy, which shows that it's been going up in the best country at that in any particular time, 3 years a decade, 3 months a year, and oh, maybe if I talk too long, an hour during my talk. Um, the and it's gone on since the article for another 7 years. So the question is, where is there any end to increase in life expectancy? But there's great, next slide. Uh, uh, there's great variation in life expectancy, even in high income countries. So from 1980 to 2005, 2012 even, the US, which is the red line at the bottom, lagged behind Japan and Sweden, which is the orange line. Denmark didn't do so well. And we asked for a National Academy panel on this, and it came out that a big part of this was that especially white women in the US started smoking earlier and smoked longer, and that's the major factor in that, plus increase in obesity, which is a factor, but less of a factor since it's better treated. Next slide, just curiosity, this shows life expectancy at age 50, shows that US is low, Sweden is sort of in the middle, and Japan way at the top. And this is just an example of, when do you grow old? When do you die? It varies by country. Next slide. Now, this cartoon says, see, the problem with doing things to prolong your life is that all the extra years come at the end when you're old. Next slide.
You know, Richard, that the European Union Commission has proposed that from 2020, each citizen will get 2 bonus years, and I hope to get it in the teenager.
Very nice.
Yes, not in the dementia. Yes.
So we're living longer and longer, and it's wonderful, even if the extra years come at the end of life. But the extra years need to be financed, and that's the basic nub of aging. It's difficult with workers to pension ratios shrinking. And what can you do? Well, you can work longer, save more, spend less, improve productivity, improve health, and reduce disability. And that's a big part of our focus. Next slide. So if we're living longer, do we get old later? Well, around 1983, Matilda Riley and I named those aged 85 and over the oldest old. And this year, I asked I commissioned the census to publish a report on those 90 and above. And in that, we've suggested that maybe the oldest old now should be 90 plus rather than 85 plus. Now, the term active aging was coined at a workshop I organized to support the 1997 G7 Denver Summit. It came after a presentation of disability and the need to work longer. I think the big ally I had at that workshop that I organized at NIH on behalf of the summit was Norman Glass of the UK, worked at the UK Treasury, and it was in part based upon his interest and that we funded the English longitudinal study on aging afterwards. But the point what I want to make here is that aging is plastic and varies across time and geography. Next slide. This slide says U.S. trends in late life disability. Around middle 1980s, Ken Manton at Duke, using something called the NLTCS, or National Long-Term Care Survey, found that disability had declined in the U.S., but nobody believed him, and everyone said it's errors. And then we found the same thing in other studies, and it became an accepted practice. And between about 1982 1984 and 1900 and 2000, disability declined about 25%. And next slide. This slide just is meant there to show that if that rate, there were different rates, but if the rate declined 1.5% a year, the aging of the huge baby boom would cause actually no increase in the total numbers of disabled. And it's the disabled who need long-term care that are one of the most expensive parts of aging. Unfortunately, in some new studies, it looks like that decline, that improvement ended, and things are getting worse, especially with younger ages. And it's mainly due, we think, to obesity. So next slide, that aging-related disability, we know that it's malleable. We don't know anything about disability trends in other high-income countries. We did fund an OECD study on this, but the data were hopeless, and I wouldn't place any much value in that. So we funded a series of panel studies to begin to look at this as well as retirement. Let me just switch now very quickly to the issue of Alzheimer's, then I'll come back to that. Prevalence of Alzheimer's is going up. That's next slide. By 2050 in the US, there, by some measures, it could cost over $1 trillion a year. Huge costs. Next slide. The problem is that the 65 and over are not quite doubling between 1990 and 2050. Next slide. But the 85 and over go up 400%. Next slide. So what we're seeing is a shrinking of the caregiver pool, and the quality of the caregivers, due, we think, to obesity, their physical ability is already declining. Next slide. One of the, I'm changing focus now a little, but I'll come back to this. The some cross-national work done by Wise Gruber showed that public pensions incentive to leave the labor force pretty well determine how long people work. In this case, it was men 55 to 65 who are not working. So Japan, they never retire. US and Sweden, they work a long time, but Belgium, Italy, France, the Netherlands, they get out of the labor force very early. Next slide. So come back to that. So the health, we set up something called the Health and Retirement Study, which is a longitudinal cohort of people over 50 and over, both members of the couple. It gets blood, DNA, income, wealth, and health, and a lot on cognition is administrative records. And there's been a viral spread to 35 countries, and we're trying to harmonize as many of those families of surveys to the HRS as we can. Next slide. So this shows this is HRS and state global coverage. This shows the expanse of these longitudinal surveys that include a survey that goes out of WHO that we fund, Brazil and Argentina are in the works. Next slide, just to show Europe. The European one is called SHARE, run by Axel Borsupan. Sweden is part of that. England has the English longitudinal study. Ireland, TILDA, which is comparable, and they're setting up now Scotland. They're trying to set up Scotland and Northern Ireland. and it's a wonderful laboratory for comparisons. Next slide. One of the findings that came out of this, was big for us, was that the U.S. people, U.S. Whites, 85 to 64, say their health is better than those in England, but when you actually look at their health and you look at physiological measures, they're far worse, even with a lot of controls. And it's not health insurance. And England is much worse than Europe. Next slide. Also, and I'm coming to the end, the this uses the same set of data, these longitudinal studies, to show that working longer seems to be associated with better cognition. And working longer, if you go back to that earlier slide, is really a factor of the pension system and its incentives. So we think it's independent. So this suggests that working, this is probably too strong a finding, and it needs more controls, but it does suggest that working longer is better for your mind. Next slide. This slide is just, you look at the bottom, it says, poor health behaviors kill. Behavioral patterns account for about 40%. This is from Schroeder's work, article in the New England Journal of Medicine, that early premature death, 40% is caused by behavioral patterns. Next slide. So most educated people know what they want to do: stop smoking, lose weight, exercise, save more, take their medicines on time. But they either never get started or they stop once they started. And we need a new science of behavior change. And we're setting, because most interventions work poorly or are very costly. So we funded a very large initiative on this. Now I want to come to the last bits of potential topics for U.S.-Swedish collaboration. First, we all have a number of twin studies. We run some twin studies in Sweden and also in Denmark. I think we're trying to harmonize them, but I think there's room there because you've wonderful administrative linkages that we use. Cross-national comparative research is another. Subjective well-being. I think that we need an indicator that is separate from GNP or GDP, and we've asked the National Academy to set up, they've set up a panel on measures for public policy. We work with the UK on this. Their Prime Minister Cameron is very interested in this as a topic, and their Office of National Statistics is working on it. And we're working with Danny Kahneman, who came up with the idea that you really need to get, there's valuative, how is your life well-being, and there's moment to moment, and that they behave differently. And I think Angus Deaton has a very important study on that, and it's being collected by Gallup in maybe 170 countries. So all right, so then other conscientious older workers, the Linnaeus database. Next slide. Perhaps connection with our Summer Institute, and I think there are interesting ideas in longitudinal studies. So thank you.
Sweden, as you have chosen the colors of the Swedish flag, yellow and blue. I think that was an intended action from you on your PowerPoint, that you use the Swedish, the color of the Swedish flag.
Oh,
blue and yellow.
You're a little indistinct. Sweden has wonderful potential for data linkage, and much better than we have. And so, for example, there's new evidence that suggests that APGAR scores, which are measured at birth seem to predict health quite much longer than we expected. And you have we're already looking at linking to some of the twin study.
A final question to Richard. I remember you said that in the US you never retired. You could retire many times, like stop smoking. You retire and then you start work again. And how is it?
Right,
How is it for you? Will you retire? No?
Well, compared to other countries, the Americans work a long time and work hard. But if you look at male retirement, it's been going down. During the last recession, it's become very difficult for older people who were less affected by the recession to get jobs, but they're staying in there because their retirement sources were hurt in the recession. They're staying on longer. But we're trying to look for ways to change the workplace to make it more attractive to older people. And I think that there's going to have to be businesses and corporations and government is going to have to adopt. I mean, soon we will have a labor shortage, which nobody is thinking about right now.
Okay. Thank you so much for your contribution, and we'll give you an applause from Sweden.